Hello and welcome to the One Hero Show, presented to you by LifeNet Health.
We're your hosts, Nia.
And I'm Kia.
And today we have April Morris. She's a nurse practitioner here in Richmond, graduate of the VCU School of Nursing, and she specializes in liver transplant. April, welcome to the show.
Hi, how are you all doing today?
Great.
We're doing
it's
great.
Good to have you here. So how long have you been a nurse and how long have you been in liver transplantation?
So I started in nursing on the floor for 2 years on a general medicine floor. And then I went on as I finished my master's degree in nursing and became a nurse practitioner. I went straight into liver disease. And so I've been a nurse practitioner in liver disease for a little over 14 years now.
Oh, wow. Authority here.
I know, right? That's a pretty long time. So I'm sure in that time frame, you've seen a lot. Can you tell us what are some of the risk factors or disease processes that lead up to a person needing a liver transplant?
So the most common risk factor of developing liver failure, liver complications, needing to look at liver transplant is developing cirrhosis. And cirrhosis can be caused by many liver diseases. The most common for many years, people think about alcohol, but the most common reason that people need a liver transplant has been chronic hepatitis C. And now over the last 5 years, medications have improved, cure rate has improved. And so now we're able to cure those patients, and hepatitis C is no longer the number one indication, but now it's non-alcoholic fatty liver disease. And that's dealing with fatty liver, not due to alcohol, but due to what we call the metabolic syndrome, things like obesity, diabetes, hypertension, high cholesterol. All of those things can lead to fat accumulating in the liver, and 24% of Americans have non-alcoholic fatty liver disease. And of that 24%, 6.5% on average can develop non-alcoholic steatohepatitis or NASH, which is the fatty liver that can develop or progress to cirrhosis. And that's the number one risk factor at this time, but also liver cancer is something we watch out for as well. And they actually get prioritized if you meet certain criteria to get listed and kind of get prioritized on that list.
Right. And that all that kind of ties into some of the things that we've talked to previous guests about, which is, taking care of yourself, exercising, eating well, everything in moderation, getting your steps in.
Yeah, a lot of prevention methods.
Mm-hmm. So what criteria does a patient have to meet to get a transplant? And, I know these patients, they have to be pretty ill. But what else has to happen? Like, what are the steps that have to be taken and the criteria that has to be met to get a transplant?
So that's a great question. So when you look at pre-evaluation, it's basically pre-transplant evaluation with patients. We look at all things. It's just not their liver. Of course, we look at a scoring system calculation called the Model of End-Stage Liver Disease, or the MELD score. And so that really tells us when do we need to start evaluation for those patients. And so when the MELD score is at a certain level, which is around 15, that's when you want to start the process of evaluating patients to see if they will actually be a good candidate for liver transplant. We look at financial, social support, psychological, making sure patients understand what's involved with a transplant. Things like lifelong medication, anti-rejection medication. We look at also cardiac disease, making sure they can handle a big surgery that can be anywhere from 5 to 8 hours on the table, pulmonary function tests. There's a lot involved with evaluating a patient for liver transplant. So that's why we start at the MELD score of 15. But then those patients typically get transplanted when that scoring system or calculation goes up to about 28 to 30. And so it gives us enough time, and that's the turning point to be able to do the things we can do to get patients listed. And so there's a lot involved, but we get the patients through it, and it's definitely worth that second chance or gift of life. And so we look at their 3-month prognosis as, will that patient pass away from, liver complications, or will this patient be here longer than 3 months? So it's a 3-month calculation of patients.
Wow.
So, yeah.
That's good to know.
Mm-hmm. So what does that process look like, that recovery process look like for a patient after a liver transplant? Like, do they get back to their life right away? Do they go home right away? What is it like for them?
So I always tell patients the stronger you are going into transplant, the stronger you are coming out of it. Now, these patients are very sick. If you need a new liver, you're going to be sick. However, we really emphasize nutrition, making sure they have the protein, muscle mass, staying active as possible. We don't want them laying around and become weak and, increase risk of infection. So really how you go into the transplant is how you recover. So typically after a transplant, patients may be in the hospital anywhere from 10 to 14 days, and then they go home. And then we watch those patients very closely in the beginning, whether it's 2 times a week or once a week, to make sure their medications are at the appropriate level, making sure they're doing okay. There's no signs of rejection. And then an average about 4 to 6 weeks in those patients actually get back to somewhat of a normal lifestyle that they're used to. But some patients may need, intensive rehab, to make sure they can build their strength. It is a big surgery. And also the time it takes to get to that surgery can definitely be a long journey. And so, but typically 4 to 6 weeks, patients tend to kind of be a little bit more independent in doing the things they want to do every day.
That's amazing. I know that,
Right.
for each organ, I think there's a kind of a different time frame for, trying to get the patient up and at 'em and out of the hospital. So that's good to know for liver.
Absolutely.
I'm sure you spend a lot of time with the patient's families. What does the donor's gift mean to the families that you work with, to those patients, those recipients that you work with?
It means everything. And we really start with our patients because you do become very close with them. As you go through the journey of the evaluation process, getting them listed, getting that organ, you do become very close because social support is very important. And it is a gift. It is a second chance at life, especially when there's not enough organs to go around. And so we do really look at those patients, kind of encourage them, for, making sure that they will take good care of their gift, and making sure there's no alcohol involved, no smoking. Those are certain things that they have to make sure they're not, drinking any alcohol, smoking any cigarettes beforehand. And so when you look at post-transplant, those patients are in a good place, and their families, very supportive, and it can be a straining thing, going to appointments all the time, going to procedures, doing things that you have to do to get listed. But family members understand how much it is a gift. If you look at, in 90 days or 3 months, could this patient be here, or can my family member be here or not? It absolutely is worth it. And they're always very, very grateful at this second chance. And a lot of people do. It's a new chapter. They do not, take advantage or squander it. They really do, appreciate this gift or second chance.
Yeah, I think, we hear from families on the donor side that they are just so pleased that their loved one has the opportunity to save someone else's life. And it's so nice to hear, from the recipient side that, we know they're grateful. It's just good to hear that from someone who's, with them after they come out of surgery and with their families for so long. So that's amazing.
Yeah, it's interesting because I've had a patient in our exam room and in tears. They're like, why me? Why was I so lucky? Why was I able to get this? And he says so many other people are deserving, and they go through an emotional thing. It's not just physical, but emotional thing to say, oh my gosh, this is a gift. And why did this happen to me? And I'm so lucky. And they're very, very grateful. So being a donor is fantastic, and to be able to give life, but also the people who actually are able to receive more life, they're very appreciative and grateful. Yeah.
So, April, you mentioned earlier, you touched on the risk factors and the things that could cause someone to come into needing a liver transplant. Could you go into more detail about some of the lifestyle changes one can make, or some of the things that they can do to prevent even coming into the hospital or having liver disease?
Sure. Yes. So takes a lot of my time now, because non-alcoholic fatty liver disease is on the rise, and a lot of patients, as I said, 24% of Americans, that is almost getting close to 100 million Americans, have this non-alcoholic fatty liver disease. And so what I tell my patients is that you have definitely diet. People want to focus on exercise, which is important, but 80% is diet. And I always say, yes, when we talk about alcohol, you can tell an alcoholic or someone who drinks excessive alcohol, hey, you need to cut back or you need to stop drinking. It's very difficult to tell somebody stop eating or, you need to cut back, or because we all have to eat, right? So we really focus on what should we be eating. And when I tell patients is you need to make sure you're around the periphery of the grocery store. Do the fresh vegetables, fresh fruit, produce, things that are around the grocery store, and stay out of the middle. The middle is the ultra processed foods that actually, high in carbs, high in sugar, ultra processed, which means it's not in its original state, and it's not good for you. It's harder for our bodies to process that. And so I really focus on we talk about the plate. 50% should be vegetables, all the vegetables you can stand. Vegetables should be the main event. 25% can be protein. And protein is not just meat. That also means things like lentils, great for protein. Beans are great proteins, high in carbs, but great protein. There's a lot of other things outside of meat, but meat is okay as well. Not saying you should stay away from meat, but maybe not fried chicken or fried fish. You can do more baked and grilled, which is better, or air frying. And then 25% can be starch, like carbohydrates, things like the pasta, the rice, the potatoes, and bread. But that should be the last thing you eat on your plate. You fill up on vegetables, fill up on protein, and let the treat or the last thing be. And hopefully you're filling up that you won't eat all of it, which should be the 25% of starch. And so that's what I really focus on with patients, is stay on the outside of the grocery store, and make the last resort to be the inside, where all the processed things are, which keeps weight on you. And really having a good weight. Exercising is important. 20% is exercise, 80% is diet. And that really will keep you strong and keep your immune system up and take care of yourself naturally versus taking medications or have a long list of medications you have to take every day.
Yeah, those are good points.
Yeah, very great.
I mean, I hope that people listening and watching can actually take some of those things and incorporate them into their lives to make some small changes here and there and kind of build on that. Because, we see patients in the hospital all the time that, the families have hope and maybe they, are getting a second opinion and they're holding out hope that something will change. And sometimes it just doesn't. And I know you see patients in your program that come in and they end up waiting too long. There's not, an organ out there for them, and you end up seeing patients pass away.
Absolutely. And so there is a lot of people, a lot of Americans, a lot of people in this world, and not enough organ donors or not enough organs out there to be able to save everyone. And unfortunately, as hard as we try, and as much as we try to get patients to hang on and do what we can and intervene as much as we can to keep them here before that organ is, until that organ is available, we do luckily now have living donors. So a family member can, or a friend, if you're the same blood type, you can give a portion of your liver, but also, organ donation, making sure you're an organ donor, especially in the African-American community. Sometimes it's, we kind of look at that in a negative way. But honestly, I'm registered as an organ donor, and it absolutely can save lives, help people who are on not just liver dialysis. Those kidney patients have to wait very, very long, a long time to get an organ, and other organs as well. But as for liver, I do see it firsthand, and there is definitely not enough organs out there. And we do have to make sure to do our part and talk to family members and friends and let people know that organ donation and when you pass away, donating your organs is not a negative thing or a bad thing, but it can absolutely save lives, whether it's a car accident or whether you're an older individual and naturally, pass away. Your organ may be in the situation that can save someone else's life. So I think the conversation definitely we need more of that, more conversation, take care of ourselves, take care of others, family members, friends, but also think outside of that and being a organ donor. I think it is an important thing.
Yeah, I think that's exactly what we're here to do, and give people the information that they need to take back to their families. make some positive changes in their own households and their communities.
Absolutely. And you just gave us so much to take back, or the viewers that are watching, I'm sure they're taking great notes, because especially when you broke down the plate and the 50%, because I'm sure some of us may have that ratio a little bit different, especially with the carbs. But yeah, thank you so much for your insight and expertise in this matter.
Yeah, it's been a great time. I really appreciate you coming on. And so that'll wrap up this episode with April Morris, nurse practitioner. Hope to see you guys soon for our next episode.
Yeah, we have another great episode coming up. Stay tuned. You won't be disappointed.
To discover more, visit our website at lifenethealth.org/onehero.